Hello and welcome to this lecture series on autonomic nervous system. We will be discussing anatomy today in the first part of this lecture series, followed by receptor physiology in part 2, and in part 3 we would be discussing the autonomic reflexes as applicable in anesthesia and surgery. The highlights of this lecture are discussion on the relevant portions of anatomy of autonomic nervous system, dealing with the composition of nervous system, explaining what is a spinal nerve, and then describing in brief the anatomy of both sympathetic as well as parasympathetic nervous system. The lecture will also highlight the key differences between both the systems as well as differences from a spinal nerve. What are the learning objectives of this session? They are to understand organization of the nervous system, to understand the difference between somatic nervous system and autonomic nervous system, to understand the anatomy of both sympathetic and parasympathetic nervous system, and finally to understand the difference between both the systems. So let us begin by asking why this class is important. Now, as we all know, the autonomic nervous system maintains the internal body environment or the homeostasis by regulating the cardiovascular system, the smooth muscle cells, glandular function, hormonal effects, and also maintains temperature, water, and electrolyte balance. Now, one of the major goals of anesthetic administration is maintaining this homeostasis to the best possible extent. As we all say, that anesthesia is nothing but practice of autonomic medicine, and therefore it's only logical that we have a sound knowledge of autonomic nervous system and its pharmacology so that we can manipulate it to ensure good outcome from anesthesia. Now, nervous system is broadly divided into central nervous system and peripheral nervous system, which is further subdivided into somatic nervous system and autonomic nervous system. It's the autonomic nervous system that we're talking of today, which is further subdivided into sympathetic and parasympathetic system. Along with that, there is a third component which is called enteric nervous system. We'll just talk about this very briefly, and then we'll go on to the main autonomic nervous system which concerns us. Enteric nervous system is considered to be the third branch of autonomic nervous system, which is different from both sympathetic and parasympathetic, as it is supposed to be locally autonomic. It consists of networks of autonomic neurons in entire gastrointestinal tract and is generally differentiated into two plexuses. One is called myenteric plexus or Orbach's plexus, which is controlling the gastrointestinal movements, and the other one is Meissner's plexus, which controls gastrointestinal secretions and local blood flow. Let's come to talk about autonomic nervous system, the main topic of the day. As I said, it is part of the peripheral nervous system, and it consists of a network of nerves and ganglia which are widely spread throughout the body. They are responsible for controlling the autonomic physiological parameters such as heart rate, blood pressure, temperature, hunger, and all other autonomic functions that you may be aware of. The system is responsible for maintaining internal homeostasis and also preparing the body for various stress responses. It is primarily a peripheral efferent system. By that we mean that the efferent pathways are very well described, and the afferent pathways They run along the somatic nerves and they are not as distinct as the efferent system. So generally, we are not aware of the workings of autonomic nervous system, and it is unique in that sense as it works in an involuntary manner. For example, we do not really come to know when our blood vessels dilate or constrict, or for that matter, our heart rate goes up or goes down. So, both the systems are anatomically separated from each other, but functionally they cannot perform their work independently, and they work with each other in an integrated manner. Now, central autonomic organization is controlled at the highest level in the cerebral cortex, whereas hypothalamus is the principal site for the organization of autonomic nervous system. The nuclei in posterolateral hypothalamus control sympathetic nervous system functions, whereas parasympathetic nervous system functions are governed by the nuclei located in midline and anterior portion of hypothalamus. The peripheral nervous system, which essentially consists of cranial nerves and spinal nerves, is further subdivided into somatic nervous system and autonomic nervous system, as mentioned earlier. The somatic nervous system consists of nerves which connect the central nervous system to skin and skeletal muscles primarily, and they have distinct afferent and efferent pathways. On the other hand, autonomic nervous system consists of nerves which connect the central nervous system to visceral organs, and they are further subdivided into sympathetic and parasympathetic nervous system. Now let's talk about what really is the difference between somatic and autonomic nervous system. As I mentioned, a somatic efferent pathway, which is well described, is unipolar, which means it involves just one neuron, whose cell body lies in the dorsal root ganglion in case of sensory nerve, or in the lateral horn of spinal cord in case of motor nerve. And the myelinated axon goes directly to the voluntary striated muscle unit. As opposed to this, an autonomic efferent pathway involves two neurons, so they are bipolar. The first neuron, which originates in the central nervous system, makes a contact with the second one via ganglion. Now this ganglion contains the cell body of second neuron and is located between the central nervous system and the effector tissue. The preganglionic neuron is myelinated, whereas the postganglionic neuron is not. Now in somatic system, the skeletal muscle cannot contract unless it is stimulated by the motor neuron. However, in autonomic nervous system, the effector tissue, such as cardiac muscle, will contract, will function anyway, but the stimulation will change the rate, whether it is making it fast or it slows it down. Now this is a picture to show you how a spinal nerve of a somatic pathway is made. Now here is the dorsal root. The cell body is the dorsal root ganglion. This is a sensory pathway, and it proceeds peripherally in the mixed spinal nerve, whereas the motor root arises from the ventral horn of the spinal cord and then comes out, goes along the ventral root, joins further the sensory nerve, and then proceeds further as a mixed spinal nerve. I will be coming to this picture again when I explain how the sympathetic nervous system is anatomically disposed. So to sum up, what really makes somatic nervous system different from autonomic nervous system? So here are a couple of points which one should remember. I'll read each and every point just to explain. Now, in somatic nervous system, the synapse is well within the central nervous system. The nerve fibers are myelinated. There is no peripheral plexus formation, and the neurotransmitter is acetylcholine. But in autonomic nervous system, the synapse occurs in ganglion, which is outside the nervous system. The postganglionic fibers are non-myelinated, and they always form plexus in the periphery. The neurotransmitter, in addition to acetylcholine, noradrenaline is also an effective neurotransmitter at certain junctions. As I said, somatic nervous system is unipolar, whereas autonomic nervous system is bipolar, that is, it's got two neurons. And there are ganglias outside the central nervous system in case of autonomic pathways. The effector units in somatic nervous system is the voluntary muscle, whereas in case of autonomic nervous system is the cardiac muscles, glands, and the smooth muscles. And in general, somatic nervous system allows adjustment to the external environment, whereas autonomic nervous system allows adjustments within the entire internal environment. So now let us come to the broad roles of autonomic nervous system. Sympathetic nervous system prepares the body essentially for a fight or flight response in the times of exercise, excitement, or any emergency. It's also called the E division of the body. And the response is manifested in form of increase in cardiac function, redistribution of blood flow, sweating, salivation, pupillary dilatation, which we are well aware of. On the other hand, parasympathetic nervous system is concerned with conservation and restoration of the energy. It is associated with rejuvenation of body, and it prepares the body for rest and digest or feed and breed response, also popularly called the D division. Now here is a pictorial description how both the systems are balancing each other. The parasympathetic system prepares the body for rest and digest, rejuvenates the body, conserves energy, whereas the sympathetic activity or sympathetic system prepares the body for fight or flight response. Now let us come the main part of anatomy of our autonomic nervous system. Broadly, sensory signals originate in the visceral receptors. The afferent nerve fibers, which I have said are not well identified, they go along with the sensory nerve, are transmitted. They transmit the impulses to the central nervous system. These signals are processed in the central nervous system, and then the motor impulses travel out via efferent fibers, which is the well laid out autonomic pathways, to ganglia. Now, till the ganglia, as it's called, the preganglionic fibers, the cell bodies are lying inside the central nervous system. From here, the postganglionic fibers arise with their cell bodies in the ganglia itself. And then these fibers terminate in the effector cell. Now specifically, let's come to the anatomy of sympathetic nervous system. The cell body of preganglionic sympathetic neuron lies in the intermediolateral horn of spinal cord. And they arise between the thoracic segments and lumbar segments, specifically between the first thoracic to the second lumbar segment. These preganglionic fibers then travel through the anterior root or the ventral root to the corresponding spinal nerves and then enter the paravertebral ganglion of the sympathetic chain through white ramus. There are 22 pairs of these ganglion on the either side of spinal column. And here is a picture. I'll draw your attention to the same spinal nerve. Now this is where the preganglionic fiber of sympathetic nervous system originates, and it traverses through the ventral root, and then through the white rami it reaches the sympathetic ganglion. These are the 22 pairs of ganglion lying on the either side of the spinal column, also called the sympathetic chain. And then from here, after synapsing, the postganglionic neuron emerges and then joins the spinal nerve through the gray ramus communicantis to join the spinal nerve and proceed to the effector cell. But once this preganglionic neuron reaches the ganglion, three things happen. Either it synapses with the postganglionic neuron at the same level, or it travels up or down to synapse in the ganglia above or below, or it might travel some distance without synapsing in the ganglion to terminate in the unpaired prevertebral ganglion in abdominal pelvis. Now, these unpaired prevertebral ganglia are celiac ganglion, superior mesenteric ganglion, and inferior mesenteric ganglion. From here, the postganglionic sympathetic neurons arise, and then they travel to the effector cell. So this is a picture showing the origin of the thoracolumbar division of autonomic nervous system, that is the sympathetic. From the first thoracic segment down till L2, the preganglionic neurons, they come out from the spinal cord, go to the ganglion, various ganglia, whether it is paravertebral or the prevertebral unpaired ganglion, and then from there the postganglionic fibers reach the effector cells, eye, heart, bronchi, and all these. It will be worthwhile to know the segments which supply particular organs. So the preganglionic fibers, which come from the first thoracic segments to fourth or fifth thoracic segment, they ascend in the neck to form three special ganglia, which are named as superior cervical ganglion, middle cervical, and cervical thoracic, also called stellate ganglion, which is made by fusion of inferior cervical ganglion and the first thoracic ganglion. And these postganglionic fibers from here, they rise up to supply head, neck, upper extremity, heart, and lungs. And they also participate with parasympathetic nervous system fibers of vagus to form cardiac and pulmonary plexus. The preganglionic fibers of 5th thoracic segment to the 10th thoracic segment, they form greater splanchnic nerve, which end within the celiac ganglia and innervate liver, spleen, kidney, pancreas, small bowel, and proximal colon. On the other hand, the preganglionic neurons of T11 and T12 form the lesser and the least splanchnic nerve, ending in celiac ganglion or in superior mesenteric ganglion, and the postganglionic neurons from here innervate aorta, duodenum, and also pancreas, liver, and spleen. Lastly, the preganglionic fibers from the lumbar 1 and lumbar 2 segment pass through the lumbar ganglion and end in inferior mesenteric ganglion. And the postganglionic fibers from here innervate descending colon and the pelvic organs. Now, I must make a special mention of adrenal medulla, which is a specialized organ, modified sympathetic ganglion. The sympathetic preganglion fibers pass directly to the adrenal medulla here, which is in the central part of adrenal gland. The cells of adrenal medulla are actually believed to be the postganglionic fibers themselves. And once they are stimulated, these cells, they secrete epinephrine, norepinephrine, and dopamine into the bloodstream directly. So this is a unique part of sympathetic nervous system which you all must remember. Having dealt with the sympathetic nervous system, now let's talk about the anatomy of parasympathetic nervous system. It is also called the craniosacral nervous system because of the location from where the fibers arise. The fibers, after arising from brainstem and sacral spinal cord, they travel to the terminal ganglia which are close to the viscera. Now here is the difference. The ganglia here are close to the effector cells, unlike the sympathetic nervous system. The preganglionic fibers, they pass uninterrupted to the organs, and then the ganglions which are located in the walls of organs, from there the postganglionic fibers arise and then finally reach the muscles or glands or the effector cell. So the cranial part of the parasympathetic is formed by 4 cranial nerves: the oculomotor nerve, facial, glossopharyngeal, and the vagus nerve, whereas the sacral outflow comes from the anterior roots of 2nd, 3rd, and 4th sacral nerve. These roots join to form the pelvic nerve or the nervus erigentis, and they also take part in the formation of hypogastric or pelvic plexus. And the postganglionic fibers from here are distributed to the pelvic viscera. A little more detail about the cranial component of parasympathetic nervous system. The oculomotor nerve arises from the Edinger-Westphal nucleus, synapses in the ciliary ganglion, and innervates the smooth muscle of iris and ciliary muscle. The 7th nerve gives off parasympathetic fibers to chorda tympani and the greater superficial petrosal nerve. After synapsing in ganglion of submaxillary and sublingual glands and in pterygopalatine ganglion, the post-ganglionic fibers, they reach the effector organs. Glossopharyngeal nerve synapses in the otic ganglion and the postganglionic fibers innervate the parotid and lacrimal glands. But it's the vagus nerve which forms the bulk of parasympathetic nervous system. Almost 3/4 of the traffic of parasympathetic nervous system is transmitted by the vagus nerve. And this supplies heart, the tracheobronchial tree, liver, spleen, kidney, and the entire GIT except the distal colon, which is supplied by the sacral part of parasympathetic nervous system. This synapses, the vagus nerve fibers, they synapse at the small ganglia which are located on or around about the thoracic and abdominal visceral organs. So now let's take a look at what are the similarities between sympathetic and parasympathetic nervous system. Both are efferent systems or visceromotor systems. Both involve regulation of internal environment, as I have said earlier, which is generally autonomous, which means that we are unable to control it consciously. Both also involve 2 neurons which synapse in a peripheral ganglion and innervate the glands, the smooth muscles, and the cardiac muscles. So here, they originate in the central nervous system. The preganglionic fiber comes to ganglion, and then from the ganglion, the postganglionic fibers arise and go to the various organs. But what are the differences between sympathetic and parasympathetic? So here is a table which lists out all the differences between the two systems. The sympathetic is a dorsolumbar origin, whereas parasympathetic is of craniosacral origin. Sympathetic is widely distributed, whereas parasympathetic effect is very discrete and is limited to head, neck, and trunk. trunk. The ganglia are away from the organs. They are well circumscribed, well described, whereas the parasympathetic ganglia are very close to the organ. The preganglionic fibers of sympathetic are short. They synapse within the lateral and collateral ganglia. But unlike that, the parasympathetic preganglionic fibers are long. And by corollary, the postganglionic fibers of sympathetic are long and that of parasympathetic are short. Noradrenaline and acetylcholine both are the neurotransmitters which are used in sympathetic nervous system, but in parasympathetic it's only the acetylcholine at all the junctions. Noradrenaline is a stable neurotransmitter, but the acetylcholine is rapidly destroyed in the synaptic cleft. The broad function of sympathetic nervous system is to tackle stress and emergency, and it's something like the accelerator of your car, which mobilizes the body for action. Whereas the parasympathetic functions to assimilate food, to conserve energy, and it's like the brake of your car, which slows the body down to keep it rested adequately, to enable the body to conserve and store energy for any future action. Now here is a concept of dual innervation rule and antagonistic control. I said in the beginning that both the systems are complementary. Their function is integrated. Most of the organs are indeed innervated by both the branches of autonomic nervous system and have antagonistic effect. For example, heart rate. The sympathetic stimulation causes heart rate to increase, but the parasympathetic stimulation causes the heart rate to decrease. The exception to this dual innervation rule, which we must remember, is sweat glands, blood vessels, smooth muscles, adrenal medulla, electropyli are innervated by sympathetic only. There is no parasympathetic nerve supply to these effector cells. And the exception to the antagonism rule is in terms of working cooperatively, that is, the sexual function in males and females is one area where both the systems work in synchronicity. Before I finish the lecture, let me mention briefly about the autonomic plexuses. These plexuses are composed of sympathetic postganglion axons, parasympathetic preganglionic axons, and visceral sensory axons. These plexuses, they provide innervation to the target organ by both the divisions of autonomic nervous system. And in the thorax, they are identified as cardiac plexus, pulmonary plexus, and esophageal plexus. Whereas in abdomen, they are identified as aortic plexus, superior and inferior hypogastric plexus. So this really brings me to the end of my conversation on anatomy as relevant to the anesthesiologist of autonomic nervous system. And I hope I have made the anatomy simple enough for you, whatever is relevant to us. I thank you all for patient listening, and then hope to see you in the part 2 of the same lecture series, wherein I will be discussing the receptor physiology, and later in part 3, where I will be discussing autonomic reflexes during anesthesia and surgery. Thank you very much. Hope to see you in the next lecture series.